Hi, this is the treatment group video for Disruptive Mood Dysregulation Disorder. I'm Casey Dahl and my client's name is Cory Foxworthy. The differential diagnoses I have for this client are Bipolar 1 disorder and Disruptive Mood Dysregulation Disorder. The primary diagnostic features for the diagnosis are 1. The client must be older than 6 and less than 18 years old. And 2, they must exhibit consistent irritability, anger, and temper outbursts that are out of proportion to provocation 3 or more times a week for at least a year. So my client's story is that he is a 16-year-old boy. He never really stopped having temper tantrums since his terrible 2s, and ever since then he has been a very hard child for his parents. And he has 2 other siblings that are doing well in all areas. Cory likes to throw tantrums about things that are that he shouldn't throw tantrums about. His mother explained that the last tantrum he had was about his show being interrupted by a breaking news show, and he proceeded to throw pillows and break things and stomped into his room and continued to throw things around. And his parents won't interrupt his tantrums because they have realized that it just makes it worse. His mother describes that while Cory is at the house, the rest of the family walks on eggshells around him because you never know what he's gonna do. And even when he's not throwing tantrums, he's very irritable. His father explains that his son has one emotion, and that's anger, and he says that he loves his son, but that it's hard to like him because he makes it so difficult. Cory also throws tantrums outside of his house. He will throw tantrums at school. He's very disruptive in class. He gets detention 2 to 3 times a week and has been suspended from school twice. All the teachers at his school never look forward to having Cory in class, and he hardly makes friends because when he does make a friend, the friend doesn't want to put up with his behavior, so he doesn't really have many friends. So that's about it for my client's story. The multi-axial diagnoses for my client are: Axis 1 says Disruptive Mood and Dysregulation Disorder, Axis 2 is none, Axis 3 is none, and Axis 4 is family disruption and school difficulties. Axis 5 has a GAF of 58. The theoretical perspective for this diagnosis is the biological perspective. The client's symptoms may be due to a genetic predisposition for the disorder. The client's family may have a history of bipolar disorder that has been associated to a high risk of children developing disruptive mood dysregulation disorder. The client's symptoms could also be due to abnormalities in the brain structure. It has been found that abnormalities with neural circuitry have been found to be linked to the development of this disorder. Children also exhibit reduced activation of brain regions implicated in emotion, attention, and reward processing, and the brain regions affected were the left amygdala, parietal cortex, and the posterior cingulate. And that's all I have for this treatment group video.